Well, I'm Gerit Mulder, and I'm Director of the Wound Treatment and Research Center and Professor of Surgery and Orthopedics at the University of California in San Diego. And I've been in wound care for approximately 30 years. And I went into the field because at that time it was still a problem, certainly equally a problem to that of today. However, there was very little interest in the area, so I saw a tremendous need medically to provide services in that area. You look at all the key components of wound healing or treatments that lead to a closure of a wound. Wound bed preparation is certainly integral and one of the most important components. Wound bed preparation allows you to remove any barriers, including non-viable tissue and bacteria, that may be slowing down the healing process. Well, you can't separate wound cleansing from the actual debridement process. Wound cleansing in itself is a form of debridement. It's allowing you to flush out surface bacteria. It's allowing you to flush out loose debris and materials that may be present on the wound bed. So when one discusses wound bed preparation, or one discusses debridement, cleansing is part of that. You can't take out cleansing as a separate component. It's part of the wound bed preparation process within itself. It is a primary consideration and extremely important because the wound bed preparation allows you to remove these factors, again, which will inhibit the healing process. If you do not remove these factors, including non-viable tissue, including free-floating bacteria in the area, as well as biofilm in terms of bacteria, then you will inhibit the normal cell activity. So you absolutely have to include wound bed preparation as a primary consideration when you're looking at the wound bed. The cost of adapting wound cleansing and wound bed preparation, first of all, is an absolute necessity. And if you look at the total cost of a non-healing wound, it is really insignificant in terms of the percentage of cost of the total care. Well, the options or the different approaches to debridement include surgical excision of a wound or surgical debridement. And of course, even when you take that approach, you still will require additional cleansing and flushing with a liquid solution or with a solution in general. The other options include topical products, which may be hydrogels, they may be enzymatic type agents. There are different agents that assist with cleansing and debridement. But even when you use these other specific approaches, such as autolysis, hydrolytic agents, surgical intervention, they still, in conjunction with that approach, will require additional cleansing with a solution of some kind. Our practice is to cleanse before and after the debridement. Initially, to remove any loose surface debris. Once you've taken your chosen approach, which the most rapid and effective would be a sharp surgical, aggressive debridement, even after you have done that, you still have to have a means through which you can flush out the material that has been debrided. What I would cautiously advise all clinicians, regardless of specialty, when it comes to wound bed preparation, is that it should always be included as part of complete care of a problematic wound, provided there are no contraindications to that specific treatment. What the clinician has to keep in mind is that part of that debridement process should be assisted by some type of product or some type of approach that will facilitate the debridement and facilitate the removal of both the debris and the bacteria in the wound bed. Over the years, I've used many different solutions and cleansers on wounds, and my primary concern, particularly in view of the increasing infection rates, increasing complications that we're seeing, particularly in the hospital settings, it becomes very important to choose something that will, again, assist with my greatest concerns, which are infection and removal of non-viable tissue. My personal choice has been to go with the Prontosan because it contains two very important components that will affect this entire wound bed preparation process. The first one is the use of betaine, which is a surfactant which will assist with the loosening, so to speak, and removal of some of the non-viable tissue. And the second component, which is very important, is the antimicrobial ingredient, which is the polyhexamide, which does have properties which are antibacterial, antiviral, and antifungal. So I'm doing two things in addition to just flushing the wound. I am using something that will assist with the debridement process, and I am using something that I personally believe will also help reduce bacterial levels and hopefully decrease the subsequent risk of colonization becoming infection. The use of Prontosan in my practice really is multifaceted because one of the areas, of course, is the chronic wound. Assisting with removal even of dressings that adhere to the surface using surfactant facilitates the removal and decreases pain upon removal of an adherent material. However, it's also used to flush the wounds, to assist with removal of bacterial material in the wound. It can be used in a gel form to provide an ongoing antimicrobial effect in the wound as well. That's one area. The second area is even in an acute wound, perhaps in an emergency room setting, it helps remove debris in the wound and also remove any contaminants that may have been introduced at the time of injury. And finally, there's the surgical setting, where we may have dehisced wounds, or even in the surgical arena and the surgical theater, it can be used to flush a wound to, again, decrease contaminants, which may subsequently lead to infection. I highly recommend, particularly in the home setting, and in the setting where the patient is providing their own care, to use a product which will, again, help reduce the number of contaminants or certainly reduce the risk of infection. And I feel in these particular settings there's a very high risk of introducing unwanted pathogens or bacteria, and using this particular product will decrease, again, the risk of a wound going from a colonized state to a heavily colonized state to an infection. So I do recommend it. My personal belief is when you're using a solution on a wound or a product on a wound, concern always becomes the growth of bacteria. It also becomes the ability of your treatment to remove unwanted cells and tissue from the product, from the wound itself. One has to look at all the products available and decide what is the benefit in terms of outcomes and what is the benefit in terms of cost. To date, I have not seen a similar product that will provide both the assistance with debridement and assistance with reducing colonization, and at the same time act as a cleanser. So it's very unique in that respect, and it's being rapidly adopted not only in our clinic, but by many of my colleagues.